We are back here on Carolina Women. I just took a deep breath because we've been like, what? Super fun.
Chaotic today.
Yeah, well, it's chaotic because it's exciting. Marissa has joined us, Revive Wellness. I'm sitting here sort of vicariously being pitiful because Erin's going to be a lip model. She's going to do all this really cool stuff, and she's so gorgeous at Revive. And
she was asked to.
No, I love this, but we're excited to see you. You're
and
the
what you do.
aesthetics part of Revive. Talk to us about what that even means.
So I work with Erin. I know you've had her on the show a couple of times. But on the other side of her practice, we do aesthetic medicine, which is Botox, dermal fillers, and skincare. Okay. So we sit down with the patient. We really drive home the skincare consultation because we want to understand the patient, what their aesthetic goals are, so that we can accurately treat them and, realistically treat them as well.
So when you talk about, you take a really thorough intake about their skin type, their practices, what they do, what they will do.
Yes, so we want to develop a treatment plan so that the patient knows too, so that they're heard before the injections even start. So they kind of know what they're getting themselves into, how long it may take, because with Botox, it might not take one treatment. It might take a couple of treatments to get to that desired look that you're wanting.
And so is it more about me saying, I'm almost 70, I don't want to look 18, but I want to iron out this, and you can refer.
Yeah, we like subtle, but we want, improvement.
Right. Yeah. And that's our biggest thing too, is that we want to enhance people's natural beauty, their natural features, not change their appearance.
Got it.
Just so we don't look tired.
Yeah, we want to restore that youthfulness. Yes.
What's the first step? Do most people look for fillers? Do they look for Botox? Do they look for skincare?
I don't think they know what they're looking for.
Well, that's fair. That's fair.
Yeah, a lot of patients come in and they don't know what they're looking for, and that's why, we're there. We help them decide what's appropriate and what's not appropriate. We don't want to put something in a patient that they don't necessarily need, and we kind of talk them through it. That way, they may need fillers as opposed to Botox, or they might need Botox opposed to fillers.
Is it age related, or is it's more just on how your skin is aging?
It's how it's aging, and it's also what your personal preference is and what you want your outcome to be.
Is the goal for most people smooth skin? Is it consistent color? I've always wanted to know this. Is it definition?
I would say less wrinkles.
Yes, a lot of people come in
because you don't want to look angry.
Yeah, a lot of people come in, they just want that smoothness back. Where there's not those deep crevices, lines on their face. So they just kind of want
that's
smoothness.
fair.
So do you do fillers too?
Yeah, so we do fillers there, and those are a little bit different than Botox. Those replenish lost volume and plumpness that as we age, we naturally lose that fat and elastin from our skin. So that kind of replaces it.
I feel like a lot of young people are going now preventatively, so they don't end up with forehead wrinkles like myself.
Early preventative with Botox is great because it prevents those deep lines from forming.
That way, in the first place.
Right, and so they're just easier to handle and treat.
So we live in South Carolina where there's constant sun versus New York where you've got 4 seasons. Do you see a difference in treatment plans for people who live consistently in the South, and do you recommend different things?
I think we would, yes, but again, it's about lifestyle, and it's also mainly about aging. So I mean, with sun exposure, if you've taken care of your skin and you're using a great skin regimen, which we have, an amazing skincare line.
Look at Maria's over there going, I have beautiful skin.
We'll admit it, we haven't.
Yeah, so skincare is a regimen. Having a great regimen is really important when you're getting injectables, because that helps the longevity of your injectables last longer. And if you have great skin, then it's going to make your Botox and dermal fillers look even better.
This is the dumbest question. Actually, it's a really good question.
No, there's no dumb question.
Under eye circles.
Yes.
It can fillers. Is that because we're hollow or we're losing collagen or?
It's like the loss of elasticin in your skin, and then just that subcutaneous fat that's in our face that as we age, we just naturally lose.
So. Is there anything more fun than doing Carolina Women and being hosting on the show? We can ask
anything we want. I hope we're asking the questions everybody wants to know.
It's pretty amazing. So we've got about 30 seconds. So for people who are really interested, Marissa, in coming and chatting with you, can they call for a consultation, or how do they do that?
Yes, call for a consultation. You can come in, we'll chat, we'll get a treatment plan going. We have specials running this month, $10 a unit and $100 off a syringe of filler.
So bring a friend.
Yes, bring a friend. Bring everyone.
I'll be your friend. Thank you so much. much. Stay with us. There's more to come here on Carolina Women.